I'm Silke Niederhaus. I'm a physician at the University of Maryland, and I'm a clinical assistant professor here. I'm going to be doing transplants for kidney and pancreas and also some liver. I was growing up in Germany, and I was a perfectly healthy 4-year-old child and played with all the doctor toys around the house that I could possibly find. So I always wanted to go into medicine, I think. When I was 8, I developed a strep throat infection, became sick from that. Ended up 3 years later on dialysis myself, and then in the same year, 9 months later, received a kidney transplant. At that point in time, I was pretty sure that I was going to be a transplant surgeon, and indeed, the day of my transplant, we went to the hospital, and the doctor asked, well, what are you going to do when you grow up, just sort of as a joke, and I said, well, I'm going to be a transplant surgeon. I kind of had it in my mind that I was going to be a transplant surgeon, went back to school after some complications with the transplant. The kidneys worked for the last 23 years without a problem. And now I'm a transplant surgeon, so there you have it. As someone who has a transplant myself, I look at transplant a little differently than other people and other surgeons do, perhaps. Well, I focus a lot on patient education. I think it's very important that patients going into transplant understand what it means for their life and how it's going to change their life, and also what we as physicians expect them to do as transplant recipients to take care of themselves after transplant. The other reason I think it's very important for patients to understand that it's their responsibility to take care of their transplanted organ is because the first transplant you're going to get, your body is most likely to accept of any of the transplants. After a first transplant, your body is likely to make antibodies. Making a second transplant, or even finding a second transplant, a lot harder, and in some cases close to impossible. And so it's very, very, very important to take your medicines as prescribed. And I know that even some people take their medicines very, very faithfully and the kidneys still don't work. That happens. But I don't think that there's any room for us as patients to add to kidneys failing when there's still a long waiting list that's increasing and we have no way to make kidneys grow on trees just yet. Here at the University of Maryland, we participate in a number of what we call paired kidney exchange programs. So if you have or are in need of a kidney transplant and you have a family member who's willing to donate to you, but they turn out not to be a match for you, we can possibly locate another pair who the donor might be a match for you and your donor might be a match for them. And then this can extend into complicated algorithms involving 20, 30, 40, 100 people across the country. And we can even ship kidneys across the country in order for you to get a live donor kidney sooner, which also cuts down on the wait list and gives you the best possible